time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're going to be talking about mental health. Like I said, today we're talking about mental health. This is such a massive topic, and the reason is because mental health affects everyone worldwide. Whether your mental health is excellent and you never have a single bad or low day in your life, or you're really struggling with your mental health and you've got a serious illness that affects every aspect of your life. The fact of the matter is that we all have mental health. And although I alluded to just a minute ago that there's some people who have perfect mental health where they never have a bad day, I've never met that person. They might exist, but I don't know them. Even if you don't have a mental illness, there will be times where you go through times of mental concern, where you might be feeling more low than usual or suffering with stress or anxiety about something. Now, these things are quite normal for us to experience in the course of our life. We have relationships, we have jobs, we have different responsibilities and different events happen in our life that will of course lead us to having ups and downs with our mental health. And there are so many different mental illnesses or conditions that you might have heard of. Things such as depression, schizophrenia, psychosis, phobias, anxiety, eating disorders. There are just so many different types of mental illnesses that those all deserve their own video. There's a lot to talk about, there's a lot to understand, but today I'm talking about mental health more as an umbrella. Although there's lots of different parts to it, often when we find ourselves in a moment of mental concern or mental illness, the process is pretty similar no matter what the diagnosis may be. So today I wanted to introduce you to something called the 4 Ps. Now the 4 Ps are factors in our life that happens over the course of time that may increase or decrease our likelihood of having mental illness. And by understanding those 4 Ps, it can help us to reduce our risk of going into mental illness, give us more self-awareness, and it can also give us ideas and tips of how we can improve our mental health if we do find ourselves becoming unwell or just find ourselves in moments where we're having more mental health concerns. So if I take you through these 4 Ps. So the first one is predisposing factors. Predisposing factors are events that happen in our life or in our background that increase our risk of having mental health concerns or mental illnesses. Now, it doesn't mean that you will get them, it just means that these things increase your risk. I'll give you a few examples of predisposing factors. The first is family history. If in your family you have a sibling or a parent or any family member that has a mental illness, it increases your risk of having a mental illness yourself. Now, it's hard to say if this is because you have been around them and it's because of the environmental changes or if it's a genetic change. But either way, we have seen that there is a link in the family history. So it's important to be aware of that. If you have a lot of family members who struggle with their mental health, maybe you should start ringing alarm bells that you need to look after your mental health a little bit more. Other factors include past traumas. So if you've had a childhood trauma, such as being abused or neglected, that will often increase your risk of having a mental health issue. Other things include having a chronic disease, so that's a long-term disease of a physical nature that you're having to deal with. Also, if you're in a very stressful or high-powered career, that can increase your risk of having mental health problems, as well as your background, and by that I mean your financial background. It has been found that if you have a low income or you come from a deprived background, your risk of having mental health problems also increases. Now, all these things, like I said, they don't mean that you will have a mental illness, but it increases your risks, and so it means that you should pay a bit more attention to how you're feeling and how your mind is doing. The next P I want to talk about is precipitating factors. Now, usually when I speak to a patient who has a mental illness or is going through some difficulty with their emotions or with their mind, there's usually a trigger. Some people, they don't know what the trigger is, but the more you ask questions, the more you delve into things, you'll start hearing that there has been a trigger. And Often, you may need to go into therapy to find out what these triggers have been. So this is what we call precipitating factors. These are events in your life that may trigger you to start having some issues with your mental illness. So what are some precipitating factors? It's just anything that may be a significant event to you, and that will change from person to person. Some common ones though are a bereavement or a death of somebody that is quite close to you, or someone that had a big impact on your life. Going through bereavement, going through grief itself can be a time that can be a struggle for some people with their mental health, and so that is one of the precipitating factors. Other things include being in financial difficulty, being in debt, going through a divorce, losing a job. All those things may be a precipitating factor as to why you're starting to feel like this. You may also have gone through a very stressful event, such as being part of a war, seeing somebody die in front of you, seeing something very distressing. It may be that you've gone through a birth that you found very traumatic and you started getting anxiety since then. It may be that you're pregnant now and your hormones have all changed, and that's the thing that's pushed you into having some mental health difficulties. It may be that you've gone through a rape or an abuse, or you've been attacked. All of these things are what we call precipitating factors. Now, as you can see, precipitating factors and predisposing factors, often there's not very much you can do about these. They're things that have happened to you in your past, or things that have happened in your family, or events that have happened that you had no control over. And so it can feel somewhat disheartening thinking about these things that you can't change. But the other two P's are things that you can change, and this is where your ability to look after your mental health come into play here. So the next one is perpetuating factors. Now these are behaviours that we do that keep us in a state of mental illness. So some examples of perpetuating factors are drug use, alcohol use, keeping yourself isolated, not having a support system, having a lot of responsibilities and stresses on, lack of sleep, and also having some what we call toxic relationships, so people that take advantage of you. Those are some perpetuating factors, and I'm sure if you sit down and you think, you might find some other factors in your life that are keeping you in this kind of state of ill health or poor mental health. Now, the last P is kind of the silver lining. It's the light at the end of the tunnel, and this is the protecting factors. Now, protecting factors are things that can do just what it said. Imagine there's mental health there. This is like the bubble that you put around yourself. The more protecting factors that you have, the stronger the walls of the bubble, and harder it is for all those predisposing, perpetuating and precipitating factors are to get in and to mess with your mental health. Now, protective factors include having good relationships, having support and people that you can speak to, not isolating yourself. Also, taking time and having good breaks so you're not becoming too stressed, making sure you're not taking on too many responsibilities, eating a well-balanced diet, getting enough sleep, getting enough exercise are all things that are protective factors. Also, building on your self-esteem and your resilience, making sure you feel confident in yourself, whether this involves, taking courses so you feel like your knowledge is better, or traveling so you feel like you're more versed in different cultures and you've exposed yourself to lots of different things. Those things increase your resilience and your self-esteem, and in turn can be a protective factor for your mental health. Also, a massive thing that you hear about so much now in the media is self-care. Self-care can mean a range of things to people, but it's basically where you take some time to just look at yourself and how you can make sure that you're in the best place. For some people, self-care will be taking time to go on a walk or to meditate. For some people, self-care is having a faith or a relationship with God and praying. For other people, it might be taking a long bubble bath or taking a weekend away, but it's just things that you do to put yourself first. And that's really what a protective factor are. They're self-care, they're the way in which you care for yourself. So when you do find yourself in a situation where your mental health is not very good or you're struggling with it, what you can always do is stop and take a minute to look. Sometimes we find ourselves so ill and unwell that we don't have that self-awareness and we're not able to really make these changes. But if you are in a position where you can, have a look at what your perpetuating factors were. and try your best to reduce those down. If you're drinking a lot of alcohol, if you're not getting enough sleep, if you're taking on too much at work, try to reduce those things down and build up your protective factors so that you can get to a place of mental wellness again. I hope that was clear and that you understood what these 4 protective factors are. I know that it is sometimes hard to really grasp a concept such as this, and what I find helps is to have examples, and so I wanted to share with you a time where I've myself have gone through some mental health concerns. For me, it was when I was pregnant. In the first few months of my pregnancy, I suffered with something called antenatal anxiety. We often speak about postnatal depression or the baby blues, but often women, when they're pregnant, and there's a lot of anxiety that's associated with pregnancy anyway, for some people that, along with the hormone changes, can cause them to start having some struggles with their mental health. And for me in particular, when I got to about 10 weeks, maybe 8 to 10 weeks, I really started struggling with anxiety and my mental health. I found it difficult to find the motivation to do things. I found myself just so anxious to go into work. I had a couple of occasions where I was driving to work and I had to pull over because I was having a full panic attack, tears flooding, hyperventilating, heart racing, everything. And that was a really difficult time, and it lasted for me a few weeks, fortunately, because I know some people struggle with those kind of symptoms for a long period of time. But I want to discuss with you what my 4 factors were and what I did to try and improve and get myself to a place of mental wellness. So for me, my predisposing factors, the main thing is my personality type, to be honest. I am a type A person. I'm very organised and I like everything to be exactly in the right place. I love spreadsheets. And so I'm quite a tightly wound person, I guess you could say. I have improved over time. I am getting more relaxed, but I am a type A person, what you would call maybe a perfectionist. And I can get stressed about things quite easily and let things bother me. So that is my predisposing factor. My precipitating factor was the pregnancy, the change in hormones and the stresses that come along with that. And then my perpetuating factor was just that I was doing so much at the time. I was going to work, I was doing my exams, there was some problems happening in my family life as well, and my dad was unwell at the time too, in hospital. And so all these things just kind of came together and was really just overwhelming for me. And I wasn't really the kind of person that spoke to many people about how I was feeling in that regard. I kind of isolated myself. And so when that happened, I decided to look at my protective factors and increase them. I first of all started speaking about it. I spoke to my husband, and there's about 2 friends that I spoke to about it as well, and who really knew what was going on. I also spoke to my GP as well, and by speaking to the GP, I didn't need any medication or things like that. They did suggest counselling, I took the number for that, but the main thing was to take some time off work, and I only took 2 weeks off. But those 2 weeks off work, I was able to reduce some of the responsibilities that I had. Whilst my body got used to the hormone changes of pregnancy, and that really, really helped me. I also spoke to them at work, and when I did return, I did a phased return to work, so I came in for half a day instead of a whole day of work for a couple of weeks until I felt that I was able to cope again. And just those slight changes meant that I was able to enjoy the rest of my pregnancy. And so I just wanted to share that little story with you. I know that people go through things much worse than I have, or much harder than I have. And those people that I see day out, day in and day out, and I try to help them as much as possible. But really with your mental health, it takes a lot of effort from you as well. There are medications that can be given, there are different therapy sessions that can be done, and I'll discuss in the oncoming videos about different mental health illnesses, what can be done for those. But really, this channel is about empowering you to take on your own health, to be the driving force to getting you to be as well as you can, to have your healthiest life. So this is just to say, maybe sit down tonight or when you've got some time and look at those 4 factors in your life. See, am I at high risk of having a mental health illness? And am I doing things that are perpetuating the situation? And what can I do to protect myself from mental illness? I hope you enjoyed the video and found it useful. If you did, please like, share, subscribe, and please comment below with any questions that you have. Thank you.